Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hey everybody, happy Friday. This is Q&A and I'm just going to jump right in. So the first question comes from Lori Asi. I just checked the feed as I was getting on my Facebook live platform, and Lori had added another question, which I'll try to fit in, but we didn't get that question in time, Lori. So I'll see what I can do. Okay. So she asks, if your C3 and C4 are low, white count is low. So now you have diagnoses of neutropenia. And now your blood work shows that you're anemic, but your ANA is normal. What should be, if any, your next step? The only answer you get is, well, it's autoimmune. And your roomie says that it is still lupus. Well, so C3 and C4 are generally acute phase reactants, meaning that they are produced in our bodies due to an acute inflammation. In our case, we have chronic inflammation, so those levels like C3, C4, and CH50 are routinely checked for disease activity. Some research points to the fact that lower complement levels can be genetic, and lower levels tend to increase the chances of one getting lupus. I am chronically low. Neutropenia and anemia may indicate an overall disease activity. Low levels of inflammation destroying red blood cells. This also can be a result of various medications as well. Lori didn't mention the anti-stranded DNA levels, so I'm just going to add it to this picture. All that to say, not all inflammatory markers are black and white for us. There's no rules with lupus as to why. Certain levels are up and they evolve over time as well. And often physicians will quizzically say it's just lupus because they can skew the baseline and play out differently for every one of us. In my early days with lupus, I used to get lost in each value that was abnormal. I used to research like crazy. I've been neutropenic, anemic, high to normal ANAs, anti-stranded DNAs have been positive to negative, and my C3 and C4 levels were normal and sometimes low. So the gauge helps us to measure disease activity. And that's why I'm here to tell you guys, because Lori asks, what can we do? Where do we go from here? There's no way to chase one biomarker. Our body works collectively as a whole system. So I want you to just focus on doing your part to support your natural laws of human physiology, which is really miraculous by design. God really knew what he was doing. No one really knows for sure how your body will react to certain meds, treatments, toxins, or even stress. What we do know is that we all have this disease, right? If you're here, something within us is a bit out of balance. All that we can do is to try to support it by decreasing the toxic burden and nourishing it with ample amounts of nutrients. So change your diet, exercise, managing stress, and getting busy creating health. Because those meds are buying us some time, but not creating health, right? So they're going against the natural order as they will cause another problem. So this is where Lori added another question. She says she's diagnosed now with having kidney disease. So if you have lupus and you have kidney disease, I'm assuming that you have nephritis or nephrotic syndrome is what I'm thinking, that you're spilling some protein in your urine. I don't know how it's manifesting for you, Lori. I've had that about 3 times. It's a very scary thing. I've had to go on chemotherapy agents and some toxic medications as a result. So what you can do right now, it depends on how bad those levels are. So go see your nephrologist, go check all those out, make sure, because we need our docs. They're just hugely important. They can save our lives. There's no doubt about that. But what I'm going to emphasize is some parts of our health now is up to you, right? So we can't just take a backseat and take these medications and assume that our health is going to play out and be safe and well. That's an active part of what we're about here as lupus rebels, to try to build health every single day to outdo the medications and really outdo lupus so that we can win. So fighting to win is key. I hope my answer to that question have been helpful for you, Lori. So please rest assured you can get better. Okay? Number 2. So let me just scroll here. Comes from Chrissy Angelo. She asks, if I'm on coumadin for antiphospholipid syndrome, is it safe to take turmeric? And do you know if MSM is helpful for joint and muscle pain? So if you're on coumadin, I would have to tell you to steer away from turmeric. Also, I would talk to your doctor to see if that's the only option for you. There are other less potent options for vasodilation, like therapeutic dose of fish oil. But again, clear it out with your doctor. As for MSM, it's methyl sulfonyl methate is the proper name for MSM. It's usually used for arthritis. If you have sulfur allergies, though, not a good option for you. It's generally safe and can be effective for some, but if you're on coumadin there again, this is also contraindicated. The reason why that these turmeric and MSM or even chondroitin you asked about are contraindicated is because they can have excessive thinning of your blood, which can be dangerous because you're on coumadin. So for right now, if you're going to be on coumadin, I would just not go down that route. Okay, so I hope that's helpful. Number 3 comes from Cynthia Hildreth. She asks, what else can a person do with vertigo? Because I struggle constantly with it. I stay feeling dizzy all the time. Could it be something else? So vertigo is that whirling, dizzy sensation that's not very comfortable. It's not fun to have vertigo, for sure. It can sometimes feel like lightheadedness as well. The most common cause of vertigo are inner ear infections or benign paroxysmal positional vertigo or Meniere's disease. BPPV can occur when calcium builds up in the canals of the inner ear, so I'd advise checking in with your ENT doc and see if that's what it is. Okay, so clear that out. Number 4 comes from Robin Biza. I'm having so many stomach issues. I can't afford to go to an integrative medicine doctor. How can I start the process of elimination to find out what I'm consuming to make me sick all the time? So we eat habitual things. So probably like 95% of what you eat is habitual. We eat the same things every day, right? So first thing to do is go under files in our group, like Facebook group Lupus Rebel, download the Elimination Diet Guide, and follow it along. We also have it in a simplified downloadable PDF for sale for just $7. If you wanted to break it down, and we have also another course which we break down week by week what you can follow. All that's up at my lupuspharmacy.com. It's a little bit more broken down. It took a lot of time and effort, and it takes time and resources for me to put it up there, and so I do have to charge a very small fee for them. So that might help you. We also have Reverse Lupus membership. I don't know if you guys know about this or not, but we've revamped this membership, and I'm super proud of it. You know why? Because functional medicine is very, very expensive, and it's sort of like functional medicine lifestyle that you can follow week by week, made easy, step by step, for just $9.99 per month. Surely you'd be able to afford that. But if you aren't able to, you can go and download the Elimination Diet Guide, and then you can follow along with it. Where there's a will, there's a way. So it's going to take some discipline on your end to try to follow through with it. But what I can tell you is that if you do follow through with it, even the Elimination Diet Guide, you're going to be hugely successful. You'd be amazed at how much how much better you feel after that. Highly encourage it. Okay? Number 5 comes from Rosalind Lindsay. Hi, Dr. Connie. Would you give me some insight into improving brain fog? So brain fog for us lupus patients is due to the underlying chronic inflammation and also gut permeability. We're not getting the nutrients into our cells effectively and efficiently, so we struggle all around, particularly with brain fog. I would tell you to start with changing your diet, get on a good therapeutic dose of probiotics, and I also have brain support formula that's been so effective personally for me. It contains L-tyrosine, an essential amino acid that helps to convert neurotransmitter dopamine to epinephrine and norepinephrine, which are found to increase memory, focus, alertness, and preserve your memory, which are all good things. I love my brain and I can't do without it. And so that's one that I highly recommend. Next question comes from Robin Moore. What to do if you're positive for autoimmune but tests to determine the type come back normal? Is the butterfly rash truly a rash or more like rosacea? I've changed my diet and symptoms. Brain fog, joint pain, and numbness have gone away. Thank goodness. That's awesome, Robin. But I feel like I'm lost. So Robin, not sure what you mean by positive for autoimmune, but the type comes back normal. That's a little confusing for me, but I'm thinking you're talking about having a positive ANA, but other differentiating biomarkers are normal. So butterfly rash, though, can be rosacea. Most people who have rosacea have butterfly-like shape, too. The rosacea still implies that your skin is still reacting. It's hard to say exactly what. So try the elimination diet for at least 4 weeks. If you want to go deeper, though, our full detox protocol will help you a ton to get the overall inflammation down. So I hope that these answers to your questions helped you. And thank you so much for such great questions. I think all around, we don't even know what questions to ask sometimes, but thank you for coming forward and asking. But I want to say that there's no magic answer. We must get busy doing our part, get clear on what a healthy diet is, rather than sometimes getting lost in the nuances of plant-based diet, paleo, keto, Whole30, etc. It doesn't even matter. Get clear on what healthy diet means for you. And if finances are an issue, start with the elimination diet, as I mentioned, under files. It's completely free. And it's also considered the gold standard in diagnosing and treating food sensitivities and also restoring gut function in the realm of functional medicine. I also highly recommend the probiotics and our Reverse Lupus membership, as it is truly intended to empower you to be your own health expert. Links are provided below, but you can find out more about our products at Lupus Pharmacy with F, pharmacy.com, and our membership and courses at alkalinehealthacademy.com. As always, please subscribe, like, and join our group. Our mission really is to help as many of you be empowered to create your own health. Happy Friday, everybody. I'll see you next week.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com